Hi everyone, we are case study number 16, presented by Daisy Pineda, Janice Guardado, and Patricia Moreno.
Our patient is a 75-year-old Caucasian male who is a retired banker. Some background about our patient is that he is a widower. However, he is leading a happy life. He is 5'10" in height and weighs 180 pounds. He has a family history of cardiovascular disease. He has had extensive dental work done. For today's appointment, he is coming in for his regular payer maintenance. The topics we will be going over are medical assessment, dental history, oral assessment, periodontal assessment, and the treatment plan. Medical assessment. The patient has no chief complaints other than his ill-fitting partial that is causing irritation on his palate. Because previous adjustments have not been successful, he is aware that a new partial will need to be fabricated. He had double bypass surgery 10 years ago and has encountered no complications since. He is currently taking Tropol and Provocol. His only allergies are bee and wasp stings and thus carries an EpiPen. He has family history of cardiovascular disease. However, he considers himself in good health since his bypass surgery. His blood pressure was 120/82. Pulse is 70 beats per minute. Respiration is 18. Although our patient had double bypass surgery 10 years ago, we will be requesting a medical clearance from his cardiologist to confirm if prophylactic antibiotics are needed prior to treatment. An update of his medical history will be required at every dental visit to avoid interference with anesthetic if needed. The first medication our patient is currently taking is Tropol, which is used for hypertension management. It is a cardiovascular beta blocker. Local anesthetic with vasoconstrictor can be safely monitored with the medication. The second medication is Provocol. It is used for secondary prevention of cardiovascular disease. A competitive inhibitor. It effects on dental treatment includes presentations of muscle weakness associated with chewing and brushing teeth. Our first question. The patient's blood pressure was recorded at 120/82. According to the new AHA-ASC guidelines for blood pressure, how would you clarify his blood pressure? The answer is C. According to the new AHA-ASC guidelines, patient is considered stage 1 because the patient's diastolic pressure is above 80 and the systolic is 120. According to ASA classifications, you are considered stage 1 if your diastolic pressure is above 80 to 89 with a systolic pressure above 120 to 129.
Moving on to the patient's dental history. The patient has received dental care throughout his life, including extensive dental work such as having 2 bridges and a root canal. The patient has numerous missing teeth. However, he also had his 3rd molars extracted in his teens due to impaction, and was in a serious car accident in his early 20s, losing several anterior teeth in both his maxilla and mandible. The patient's last dental visit was in December 2020 for his 3-month perio maintenance appointment and for his partial denture adjustment. His last FMX was taken on April 2018, and since then gets yearly recurrent x-rays, which consists of bite wings and PAs. Most current x-rays were taken in March 2021. Intraoral images have also been assessed. Caries have been detected with current x-rays and intraoral photos. This includes tooth number 4 with surfaces DO, 5 occlusal, 13 occlusal, 19 buccal, 18 MO, and 20 class 5. The following shows the patient's most current full mouth radiographs, and we can see all the restorations the patient has. For example, on the maxillary anterior, we have a bridge placed from tooth number 8 all the way to tooth number 10. We also have amalgam restorations on tooth number 18, 19, and 20. We also have another bridge placed from tooth number 22 all the way to tooth number 26. We also have a porcelain fused to metal crown placed on tooth number 27. There's also a root canal placed on tooth number 29, and we also have an amalgam restoration on tooth number 30. We can also see the absence of missing teeth happening on both the maxillary and mandible arches, as well as we can also see bone loss and furcation involvement. Question number 2. The radiolucency surrounding the apex of the maxillary right lateral incisor illustrates the presence of A. fractured tooth, B. bone loss, C. Artifact, or D. Internal resorption. The correct answer is B. Bone loss. The radiolucency illustrates the vertical bone loss happening on tooth number 7. Patient's oral assessment. During the patient's EO-IO exam, lymph nodes, TMJ, thyroid were within normal limits. Intraorally, the palate seemed inflamed on the central region, and the tissues on that location where the partial is housed appeared pale and hyperkeratotic. The Akusa classification, based on the intraoral images given, the molar calcification cannot be assessed due to the missing teeth happening in both right and left maxillary posterior regions. Canines are class 1, but the right canine has a tendency of a class 2. The maxillary canine is mesial to the mandibular canine, but the distance is less than the width of a premolar, which makes it a tendency class 2. Overbite can be approximately 2 to 3 millimeters, and overjet approximately 1 to 2 millimeters.
Moving on to gingival description. Here we have 2 intraoral pictures of our patient, and we can see that it's very generalized pinkish white, firm, rolled, blunted, fibrous, blanching, shiny, and glossy. And underneath we've also made a table with maxillary free gingiva, maxillary attached gingiva, mandibular free gingiva, and mandibular attached gingiva, and describing each. Periodontal assessment. Here we have our patient's chart. Let's break down our findings. We calculated our patient's MBI, and it's 25%. We calculated our patient's BOP, which is also 25%. The teeth that bled upon probing were maxillary teeth number 4, 5, 8, 10, and 13. The palatal aspect of the maxillary teeth BOP occurred on tooth number 7 and 13. On the mandibular buccal aspect, BOP was present on tooth number 18, 19, 29, and 30. On the mandibular lingual aspect, BOP was seen on number 19. Exudate was not present. We noticed recession and mucogingival involvement on the locations of teeth number 4, 5, 8, 10, 13, 18, 19, 20, 22, 26, and 29. Affrication class 2 was recorded for tooth number 19. Mobility class 2 was recorded on teeth number 18, 19, and 30. And a class 1 mobility on teeth number 4 and 5. Based on our patient's chart and intraoral photos, we have classified him as AAP Stage 3, Grade B, and WLAC Calculus Code 6, Medium Heavy. We use the 5 components of dental hygiene to develop our case: assessment, diagnosis, planning, implementation, and evaluation, better known as ADPI. Moving on to the last topic, treatment plan. For our treatment plan, we have 6 appointments, and we scheduled the appointments in the following way. So for appointment 1, we will give our patient peroxal rinse. The patient will be assessed by the dentist. Extraoral and intraoral examination will be given. We will request medical clearance from the patient's cardiologist to confirm if the patient needs prophylaxis antibiotics prior to treatment due to his coronary bypass surgery 10 years ago. We will review the medical history, take radiographs and review. We will take intraoral photos, probing measurements, exploring, and we will give the patient OHI and review treatment plan with the patient. Before continuing to the rest of our appointments, we would like to note that we will be giving peroxal rinses to our patients prior to any treatment. We will be reviewing medical histories at every appointment. We will take vital signs at every appointment. We will be conducting EO-IO examinations at every appointment and giving OHI at the end of every appointment. So continuing with appointment number 2, we will start the upper right quadrant, perform SRP with local anesthetic. For appointment number 3, which will be scheduled a week later, we will reassess the previous quadrant worked on and then start the lower right quadrant, perform SRP with local anesthetic. For appointment number 4, given a week later, we will reassess previous quadrants worked on, start upper left quadrant, perform SRP with local anesthetic. For appointment number 5, given a week later, we will reassess previous quadrants worked on, start the lower left quadrant, SRP with local anesthetic. For appointment number 6, which is given 4 to 6 weeks later, we will reevaluate the periodontal health of the patient. We will also probe and explore, perform selective polishing, apply fluoride treatment, and also schedule the next visit, which is the 3-month perio maintenance appointment for our patient. Here listed are our references. That is the end of our presentation. Thank you very much for listening and thank you for your time.